Well, why don't we get started? It's 7:30. My name is Jim Greenblatt and a founder of Psychiatry Defined. We've been for 6 years now teaching clinicians this concept of precision psychiatry. How do we use integrative and functional tools to improve outcomes for our patients? And so, really pleased tonight to introduce Headlamp Health, a really unique software platform that I'll share some of my thoughts at the end. But I think there's just a unique role for helping integrative and functional clinicians. So we're fortunate tonight to have Christy Wiley, who'll be giving the background of Headlamp Health, and then Dr. Faraday will kind of describe his couple years of using this platform. So I'll pass the mic to Christy and then come on at the end and share some thoughts. Thank you and welcome, Christy.
Thank you, Dr. Greenblatt. And thank you everyone for joining us tonight for this informative discussion on transforming mental health care with precision data. I am Christy Willie, as Dr. Greenblatt shared, with Headlamp Health, and we are really excited to be partnering with Psychiatry Redefined and Dr. Greenblatt. And we also will have Dr. Sean Faraday, who is with Pinion Family Practice in New Mexico. He will be sharing some of his real-world examples of utilizing Headlamp Health in his practice a little later in the presentation. So tonight we are going to cover the current landscape in psychiatry and some of the challenges you face in your practice. What is precision psychiatry and how can we benefit from it? Excuse me. Enabling tools and technologies to be able to integrate precision psychiatry into practice, and then real-world applications with Dr. Faraday. And at the end, we will have some time for Q&A. So if you have any questions at all, please do not hesitate to put them into the chat, and we will try to answer them after the presentation. So first of all, I just want to recognize all of you that are here as psychiatric clinicians, because we know that you have a very challenging job. And we really appreciate all you do and want to thank you for what you do for patients every single day, because you are consistently navigating very complex clinical challenges in your practice. And these are just a few of those challenges, and they are going to be more related to access to information. So first of all, fragmented patient history. It can make it really difficult to get a full picture of your patient's health because their history and their records are scattered all over the place. And beyond that, we are relying on patients to remember what medications they've tried in the past, what doses they've taken of those medications, and even diagnoses maybe they have received from other providers they've seen. And then subjective progress tracking, that is also relying on self-reported symptoms, and those can be inconsistent. And data overload and limited time, I'm sure this resonates with everyone, in the fact that there's just increased administrative burden on you as clinicians and on your staff to manually gather and coordinate patient information, which leaves you dealing with so much more administrative work than you want to be doing and reducing that valuable face time that you have with your patients. So all of these things can really hinder the ability to provide the most effective treatment for patients, but precision psychiatry is really aiming to change that. What is precision psychiatry? Precision psychiatry applies to real-time, data-driven insights that deliver more personalized and just whole person care for patients. There are multiple approaches to precision psychiatry, one of those being genomics, using genetic testing to predict medication responses and risks, biomarkers, leveraging lab tests and imaging for helping with treatment guidance, digital phenotyping, which can be activity tracking, sleep tracking, physiological data, and that could be via patients' wearables. And then most importantly, in my opinion, the data integration. So bringing all of these insights together for a really comprehensive view. So this shift toward precision psychiatry really enables much more accurate diagnoses, more targeted interventions, and just overall more proactive care. There really isn't one specific definition for precision psychiatry. We see it as a framework that is a move toward individualized care for mental wellness. And the most important piece of this framework is going to be data. There is so much power in data. I think we can all agree that when we have more measurable insights and just more information in general, we're able to make better decisions. And all of the other parts of this framework really rely on having that data. So being able to provide personalized care and tailor treatment to individual patient needs, we need data to be able to do that. To be able to be more predictive and anticipate treatment outcomes, and also to have more preventative care, catching issues early before they escalate, because this is much more proactive versus reactive treatment. So by incorporating all of these principles, we can improve patient outcomes while reducing the trial and error treatment approach. But you may be asking, why is this not standard of care already today? And why can we not be utilizing more data in our practice? And of course, I'm sure you're thinking it sounds easier than you're saying it is, Christy. And that there are a lot of challenges you face with trying to access data. And that's because data lives in silos. So as I said earlier, patients' data is scattered all over the place. They're seen at multiple different health systems, they're seen at different clinics, and their data is everywhere. And then there's lack of interoperability. Hundreds of different EHRs out there to choose from. It's really difficult for you, I'm sure, in practice to decide which EHR you're going to use. I think I hear of a new EHR every single day. And unfortunately, those EHRs are not talking to each other. And then there could be privacy concerns, especially with psychiatric data, that could create barriers to data sharing. And of course, limited resources can make it difficult for clinics to implement these technologies. However, I want to assure you that there are new tools emerging to help to bridge these gaps that are helping psychiatric clinicians access data now. So why precision psychiatry now, and why is it no longer just a future vision? Because you do need comprehensive patient insights. And imagine having patient medical history and wearable data all in one place. And being able to provide real-time and proactive care by adjusting treatments dynamically instead of having to wait for follow-ups. More efficiency and time savings is going to be huge for anyone, right? To be able to reduce that administrative burden and be able to spend more time with patients. And then the engaged, empowered patients, we all know that when patients are more involved in their care, they're going to have better outcomes. And giving patients more control over their care is important. I think we would all agree that when patients have personalized insights, it really helps them feel seen and it helps them feel heard. And overall, it's just helping them be more involved in their care. There are affordable tools here that help you get access to the data. One example of these tools is Headlamp Health. So how does Headlamp Health work? Headlamp is a platform designed to enhance the collaboration between clinicians and their patients. It's going to connect you with comprehensive patient histories from over 75,000 hospitals, clinics, and pharmacies across the country. It's going to help you collect patient-reported data through consistent logging, assessments, and questionnaires via the Headlamp Health app. And it's also going to help to integrate data from patients' wearables like smartwatches. So one of the things you might be wondering is, where does this data come from when you say that you are able to get that past medical history? Headlamp Health is connected to the Health Information Exchange. And the Health Information Exchange is a data sharing hub designed to enhance interoperability among healthcare providers. It allows EHRs from different systems to be securely shared with HIPAA-compliant networks, enabling hospitals, clinics, and other healthcare entities to access and utilize patient information more efficiently. So you can think of it as connecting the dots between healthcare systems, between clinics and practices that already have the information that you need to help you provide better care. And Headlamp is really unlocking that information to be able to securely give you that access. There are other specialties that have had access to data like this for years. So oncology being one of them. In oncology, they've been utilizing precision medicine and more personalized medicine for years and seeing great results with it. We want to bring precision medicine to mental health care because you as psychiatric providers deserve to have that to be able to treat your patients. I know many of you on here are part of Psychiatry Redefined, and I see you as the pioneers of integrating functional psychiatry into your practice. You can think of Headlamp as a pioneer to bringing you these tools to your practice that will allow you to walk in with real-time data for patients and then actually be able to continue monitoring patients with this data more efficiently and effectively. Headlamp is a companion tool to your EHR, and it can accelerate what you're already doing in your practice today. So I'd like to share with you what your experience would look like when you integrate Headlamp into your practice. I'm just going to go ahead and switch over to our demo site here. So as we mentioned, it is difficult right now today for you as mental health care providers to have access to patients' past medical history, because if it's not available in your EHR, you're having to track it down from previous providers, from pharmacies, or you're having to rely on patients to recall and having to go based on what they remember. So you might hear things like, I know I took a white pill last year, I just don't remember what it was called. And that's not very helpful, as we all know, because you really need to know what medications they have already failed so that you can prescribe medications that they have not already tried in the past. So to be able to have access to patients' past medications would be very valuable, and even access to the dose of that medication and when they were prescribed that medication. So when we connect to the Health Information Exchange, we're able to pull in all of this data. And what Headlamp does for you is takes the data and organizes it into this user-friendly dashboard so that you just really have the information that you truly need. With the medications, you're going to have access to the psychotropic medications, but also other medications that the patient has tried. So not just psychotropic. We just keep those separated since we are focused on mental health. If there is enough data on a particular medication, you can click on that medication and you would be able to see the journey that the patient was on when they took that medication. When did they start it? When was the last time they filled it? Did they titrate up to the highest dose? So that maybe it's possible you do want to try a medication again for a patient, and then you'll know had they actually taken the highest dose of that medication at the time. You're going to see the same with diagnoses, where you're going to have your psychiatric diagnoses, and then you're going to have others as well available to you. Providers is going to be current and past providers that the patient has seen. This can be helpful because you may need to reach out to a previous provider to get additional information from them. And this way, when you click on them, it's going to show you where their NPI number is registered to and be able to give you contact information of how you can get in touch with them. There are other categories you see here that can pull data in from the Health Information Exchange, but also this can be patient-reported data. The patient can report things through the Headlamp Health app that will then populate here on the clinician dashboard. And you would be able to see that the item was added by the patient, like you can see here. You also would have access to hospitalizations and even labs. And the labs are organized very well. So if you click on those, you would be able to have a very clear view of that data. So as you're looking at this, there might be a few things that you're thinking, one of them being, how did I not know this existed and I could have access to this? Because I know we do have some people on here from other countries as well outside the US who may not feel like this is something that they need, because in a lot of other countries, universal health records are available. But unfortunately, in the United States, we do not have universal health records. And so this is going to be about the closest that you'd be able to get at this point to having a universal health record for your patients. You also might be thinking, wow, this could really save me a lot of time, especially with new patients and streamlining patient intakes. So having this comprehensive medical history, and it can really reduce the time spent in your initial consultation with patients, and you can just spend more time talking with patients and focusing on what their current issues are and what your treatment plan is going to be with them, rather than having to take so much time to figure out their past medical history. And then another piece of Headlamp is that we are offering, as I mentioned, there's a Headlamp Health app, and there are a lot of apps. I know there's a lot of apps out there, and patients may be utilizing apps to do tracking of things like moods and activities and maybe sleep. But the issue with other apps is that typically that data is not feeding back to you as the clinician. So they can track all of they want, but you don't have access to what they've been tracking. And so with Headlamp, if you click on this next tab on your dashboard, you're going to have access to what the patient has been tracking in their app. So when a patient comes in for a follow-up, you're typically asking them, how have you been doing? And the patient may recall how they've been doing the last few days, but not necessarily how they've been doing, say it's been 30 days since they last saw you. You could set this dashboard to 30 days and be able to see what the patient has been logging. So the patient logs into their app and they would track their pleasantness and energy on a daily basis. And then you would have that longitudinal data here to see how have they've been doing with that over time in the last 30 days. Has it been pretty steady? Have they had a lot of ups and downs so that you can address that in their visit? They also select moods that day that they're feeling. And what you're able to do is use these charts to see what mood has the patient been selecting most often, and what are some factors that might be contributing to those moods. Below that, you're going to see if a patient chooses to upload their Apple Health data, you will have access to that data from their wearable that they have. So if they upload their data, which we are finding that most patients do, you would have access to sleep data, activity data, and sometimes even daylight exposure, depending on the type of device the patient has. We all know that sleep and exercise are very important lifestyle factors when it comes to mental health. And so having access to that data and not having to rely on patients to just remember and tell you how they've been sleeping could be incredibly valuable. You see here, if you click on details, you'll get even more details about the sleep so that you can see how much time they're spending in bed, how much time of that is awake time, even their deep sleep and their REM sleep. And then a somatic score is calculated to measure how well the patient is managing all of those factors. And this cognitive performance score, that is coming from a Stroop test that the patient can engage in each day that they are on the app. And then additionally, the patient can log customizable activities in the app. These are activities that the patient chooses that they want to be paying attention to in between visits, that they want to be held more accountable to, maybe things that you've asked them to pay attention to. You, as the clinician, can also make suggestions to the patient of things that you would like them to track between visits. So you can see some examples on here. Other ones I've heard providers do would be caffeine intake, sugar intake, time on social media. So just anything you can think of, it can be customized within the app for the patient to be able to track between visits. So you can see how all of this and them logging is going to really be able to provide really great insights for patients, but also help you as a clinician be able to facilitate if more efficient and focused follow-up visits with patients as well. And then finally, because we want you to really have a comprehensive view of your patients beyond just the medical history and the mood and activity tracking, we have this patient profile tab. Patients are going to have the opportunity to take psychological or personality assessments within the app. And if they do those assessments, you as the clinician are going to receive the results of those assessments here under this tab. And so again, this is enabling them to gain deeper insights about themselves, but you as the clinician to learn more about the patients too, so that you can really tailor your conversations with them in the follow-up visit. So imagine knowing what their 5 core values really are and being able to utilize that information so that you can tailor your conversation with them. We can also facilitate rating scales within the app. So if you choose to do that and the patient takes a rating scale in the app, you would then receive the results of that rating scale here. So now I would like to ask Dr. Sean Faraday to go ahead and share some of his examples about how he has utilized Headlamp Health to integrate precision psychiatry into his practice and how he is seeing the value and how his patients are as well.
Hello, everybody. Welcome. Christy, great job with your presentation. I am a physician in Farmington, New Mexico, in the Four Corners region. I've been here in Farmington for 27 years, believe it or not, um, and in this practice for 25. So I have a pretty established practice. I do full family practice medicine and see a lot of psychiatric patients. We have been using in our practice, we have 10 providers here, and we have been using Headlamp full force since July of 2024. And I think we have, myself, I think I have around 90 some patients that are enrolled. Um, so I was just going to give you guys a quick some snippets of some of the patients and some of our experiences with Headlamp. And so one of the first patients that I'm going to talk about, her name is DL, and I've actually known her for 20 years. She's had significant trauma in her life, uh, physical abuse, mental abuse, and she has been on multiple medications over the years. And um, we have shepherded her through some difficult times, and she finally decided to move, which was probably in her best interest. Started a new life, but I'm still her physician, and I actually see her through telemedicine. She's in another town in New Mexico. Anyway, she was able to wean off of all of her medications with the exception of um, Xanax, which she would take very rarely. Um, and she was under the care of a counselor, and things were going very well. We had enlisted Headlamp with her. Really, she was one of our first patients, and she called and wanted an appointment with me and was identifying that she suddenly was having significant problems with her depression and mood. And she was wondering if she should be restarting bupropion, which we used successfully in the past. But when we looked at her headlamp, it was an amazing insight to see with her passive tracking through her Apple Watch that, in fact, that her daylight exposure had just plummeted. Um, she was usually getting around 40 to 50 minutes of daylight exposure a day. And I said, well, what's going on with your daylight? How come suddenly you're at 10 minutes a day? And she really didn't realize that. And she understood that this was due to a new job and she was just not walking at lunch. Um, just with changing that within 4 to 5 weeks, her mood improved and we never really needed to restart bupropion. I had a follow-up appointment with her actually earlier this week, after I spoke with Christy to prepare for this. Um, and we identified on her headlamp that she was having some difficulty with sleep. And she goes, "Oh, I've been having that type of problem my entire life." When we looked at her REM and her deep sleep patterns and her awakening cycle, it looks like she likely has sleep apnea, which was pretty surprising to us given her habitus. So we are now embarking on looking at that as a potential cause of what's been going on. So I thought that was an amazing insight that we've had even since we spoke last, Christy. Um, Another patient that I'd like to talk about is who do we have next? I think it's, yeah, KO. She's another patient that I've been taking care of for years as well. And she's been dealing with anxiety for quite some time. And in fact, she finally came in and saw me about perhaps treating this. And, in reviewing and going through things, it certainly seemed that she was having classic symptoms of anxiety. And in fact, had a pretty high GAD-7 score on my initial intake, had never been on any treatment. We enlisted her on the Headlamp app. And, as Christy showed in patient profile section, she filled out our rating scales and her GAD-7 was elevated, but it also showed a significant elevation in her ASRS B1.1, showing that, wow, she had significant problems with ADHD. And we really didn't identify that until we saw that. And then looking into that further, we identified that this was probably the source of a lot of her anxiety. We switched gears and now we are treating ADHD, and she has had incredible success. So the headlamp again was able to really show us, what was going on under the surface, which was an amazing thing. And then lastly, Christy, I can't remember who we have. Oh, yes, DE. She's one of my longtime patients as well. I take care of her entire family, her children, as well as her parents. And she does have a lot of ongoing issues with bipolar disease, as well as situational anxiety that is related to some incredible stressors that she has been facing as of late. Um, she does have a history of sleep apnea, hypertension, and per usual, how is it going with your sleep apnea? How's it going with your blood pressure? Fine, fine. Yeah, I'm sleeping well. And the assumption was that she was using her CPAP for sleep apnea. Again, we're looking through her data because she was a headlamp patient. Um, and I realized that her sleep data was not on her profile. And I go, don't you have an Apple Watch? And she goes, oh, yeah, I do. And then I realized that it was just switched to a different device that she had loaded. And so we switched it to her Apple Watch, and her sleep was horrendous. She was getting perhaps 4 or 5 hours of sleep, very interrupted. And I said, so DL, what's going on with your sleep here? Um, and she finally admitted that she just wasn't using her CPAP. And before changing anything with her anxiety meds or considering a change with her treatment plan, we are now getting her back on CPAP, and hopefully we'll be seeing her back in the next week or so, and really move forward with what really needs to happen here. So this really tells us, Headlamp has been very helpful in with the patients understanding where their problems may be. It helps us be more precise in what we're dealing with. And I've been very pleased with what we have seen. So I hope there's some questions towards the end regarding this, but I'll be here to answer your questions later. Thank you.
Thank you, Dr. Faraday. I think, those cases can really highlight how real-time data truly can transform psychiatric care. So I really appreciate you taking the time to share those with everybody. And also, I just wanted to recognize that it's not just clinicians who find Headlamp Health valuable, but patients do as well. These are some of the comments that came from patients when we had sent out a survey to some of the patients that have been using Headlamp app. And you can see that some have shared that they finally feel in control of their treatment. They can really track their progress more objectively. And then they feel like they have more productive conversations with their clinicians in their follow-up visits. And as you can realize, patient engagement is going to be a huge piece of this, right? So we're going to need patients to engage in the app in order to get this data. And I'm really excited to share with you that our patient engagement with Headlamp has been great. It's actually 3 times the industry standard for mental health apps. So having that level of engagement is really going to lead to having better outcomes. So some of the key takeaways from our presentation, first of all, precision psychiatry can truly be a game changer in your practice. It's going to help you have more personalized treatment for patients to really be able to tailor to the individual patient needs. You're going to have more data-driven decisions based on more objective insights. Clinical efficiency, as we talked about, you're wanting to reduce that administrative burden to be able to spend more time seeing patients. And then improved outcomes ultimately is what we really want to be able to lead to better patient well-being and to mental wellness. So by leveraging technology and real-time data, I think we truly can transform mental health care. So we want to help you and your patients in your practice. So if you are interested in integrating precision psychiatry with tools like Headlamp into your practice, we'd love to get you started. What we're going to ask you to do is to visit our Headlamp headlamp.com Psychiatry Redefined page, or right now you can scan the QR code on this page and it will take you to that landing page. We'll leave this page up for you. And that way you can schedule some one-on-one time with our team. I would love to be able to talk with you about your practice and how your practice workflow looks and just how you're treating patients currently today, and see if Headlamp can help you streamline your workflow. We're also offering a special event offer for Psychiatry Redefined community and anybody who has attended this webinar. So we'd like you to be able to take advantage of that. You can also contact me with any questions directly. My email address is christy@headlamp.com. So I'd be happy to discuss that with you. Another place you can follow us, we'd love to have you follow us on LinkedIn as well. We're posting regularly on LinkedIn, and don't ever hesitate to reach out to tell us other challenges you might be facing in your practice and how you think Headlamp can maybe help with those, because we're always wanting to continue to improve what we're doing and be able to offer more tools for clinics. So right now, I'm going to just go ahead and open this up for Q&A. So if you do have any questions, you can go ahead and put them in the chat, and we would like to address those questions for you before we go ahead and wrap up the presentation.
Awesome. So Christy, the first question that we have in our chat is, do patients have to consent to the clinician using this platform to use Headlamp?
Yes, that is a great question. And actually, yes, patients do have to consent. They're consenting to us being able to pull their health history data. So what happens with Headlamp is it's a very simple way to add patients. You have your dashboard, you enter a patient with their name and their mobile phone number, and a patient's going to receive a text message that will ask them to download the app. It's a free app for patients. And once they have downloaded the app and put their information in, the first thing they're going to do after that is they're going to go ahead and do a consent that allows us to pull their health history. So the patient does consent through Headlamp. We do have some clinics who also choose to do their own consent and have patients consent prior to even entering their name and phone number into the dashboard to add them. But that's completely up to you as a clinician. We do the consent that's needed through Headlamp.
Great. The next question that we have is, does this integrate with Epic or Cerner? So if you can share a little bit about that.
Yes, that is also a good question and one that we get often. And as I shared earlier, Headlamp is truly a companion tool to your EHR, so it is not going to be integrated directly into your EHR. However, we do hope to have that down the road someday. But again, as I mentioned earlier, there's hundreds of different EHRs, so being able to integrate with all of them is truly challenging. So what we have done is on each page of the dashboard, there's an export data button. And we have made it so that it makes it very simple for you to export the data from each page into a PDF or Excel file so that you can put that into the patient's chart if you would like to have it in the chart.
Awesome. The next question that we have is, do clinicians ever incentivize patients to utilize Headlamp?
So I have not experienced a clinician incentivizing patients at this point, but that's definitely something that interests me and intrigues me to see what your thoughts are there on doing that. I will tell you one thing that we do, Headlamp does to incentivize patients, is we do have a rewards program. And so as patients are utilizing the app, they can earn points for their engagement within the app, and then they can utilize those points to purchase gift cards. So we are doing that within the app that's from the patient to Headlamp to help them be more incentivized to engage in the app.
Great. Thank you. The next question we have is on pricing. How much does it cost?
Yeah, also a very good question. So for our special event offer for anybody who has attended the webinar, it is $59 a month per clinician. There are different amounts that go into play. So if you are part of a very large practice, that pricing could look differently for that. But if it's an individual clinician practice, it would be $59 a month for your practice. And that is unlimited patients. You don't have to worry about adding a certain amount of patients. You can add as many patients as you would like.
Thank you. The next question that we have is from Devin Bailey. So the question is, I'm an integrative family med and psych clinician. I think I heard you say that we'd have access to the entire history and meds, not just psych. Is that correct?
Correct. You would have access to all medications, not just psych medications, and that would be the same for the diagnoses as well. You would have access to both. We just separate them out to make it easier to be able to see those psychotropic medications more easily at first glance, because sometimes these medication lists can be hundreds of medications. But yes, you would have access to both.
Great, thank you. And there's another question. We've already answered a part of this with pricing, but Scott wants to know, I work for an Indian tribe in Arizona. Does the IHS upload patients' medical information to the shared database?
That is a good question. We'd probably have to check on that separately for you, Scott, I believe you said. So if you want to reach out to me, we can check. We're able to look into the Health Information Exchange and see clinics that are connected to the Health Information Exchange. But just so you know, clinics do have to opt out of the Health Information Exchange. So it's more likely that a clinic is opted in. Also, your clinic in particular doesn't have to be opted in for you to utilize Headlamp, because if you think about it, you're actually trying to receive data from other clinics that patients have been seen at. So it's more important that the other clinics that they've gone to are connected. Your clinic individually that you're seeing them at today doesn't have to be, but of course it's great if it is, because then other people who are utilizing something like Headlamp would have access to that patient information as well. But Scott, again, if you want to just reach out, we can check that specifically for you.
Great. And then it looks like we have our last question. Does your platform only integrate with Apple products, or will it work with Samsung watches too?
We are almost there with Google Health. So with Google Health Connect, that is going to be launching very soon. I want to say in the next couple of weeks. So we're able to be able to support both Apple Health and Google.
Wonderful. Well, thank you, Christy and Dr. Faraday, and really enlightening presentation. I think for many of us, myself in particular, as a kind of billing myself as a functional psychiatrist, most of my world is consultations. People that have been to doctors and more doctors, and the amount of information that I need is overwhelming, and they're with mental health challenges can't get that. So just to think about, to have a list of medications and diagnoses and treatments before I do a consult is just incredibly valuable and pretty exciting. And I think that's what many of our community in Psychiatry Defined are doing, is consultations with challenging patients, and having that data is just critical. So thanks again, Christy. We'll be communicating and talking and continuing educating our community with this incredibly helpful product. And thank you, Dr. Faraday, for sharing those examples. Appreciate your help, and we'll stay in touch.
Thank you so much for having us. We really appreciate it. Everybody have a great night.
Good night.